The Rhode Island Foundation, partnering with passionate Rhode Islanders to lead, transform, and inspire our state. Learn more at rhodeislandfoundation.org.
Welcome to another segment of In Another Opinion, a public information program where our discussions are focused on the communities of color in the state of Rhode Island. I'm your host, Peter Wells. My guest today is Carrie Bridges-Feliz, MPH and Director of Community Health Institute, Lifespan. Welcome, Carrie.
Thank you for having me.
Oh, it's our pleasure to have you on. I've been trying to get you on for a while, and our schedules haven't run together, but today you're here.
Today it clicks.
Yes, it does. Carrie, listen, before I get into the meat of the discussion, tell me a little bit about yourself. Where you're from, how'd you get to Rhode Island, if you're not a Rhode Island native?
I'm not a Rhode Island native. I'm originally from Chicago. I was born there. But we moved when we were young. My father's job took us to upstate New York, and then Connecticut, and then North Carolina. So most of my schooling years were in North Carolina, middle school through college. I went to Duke University there for college, and when I graduated, I did an AmeriCorps program called Teach for America.
Yes.
That took me out to Phoenix, Arizona for 2 years.
Wow, that must have been fun.
It was fun. It was a tremendous growth opportunity and service opportunity. An invaluable experience. I actually think everyone should teach. It should be like mandatory service because you learn a lot about yourself and learn a lot about helping and supporting communities. But after Phoenix, I went to graduate school to get my master's in public health. That took me to Boston University School of Public Health, and then a fellowship job in Atlanta with the Centers for Disease Control and Prevention. And that fellowship is actually what brought me to Rhode Island. So the CDC assigned me to the health department here for 2 years. And I had the pleasure of getting the refugee health program launched here.
Okay.
And then the opportunity to take on some other responsibilities. And now it's been 14 years and I haven't left yet.
Rhode Island kind of grows on you.
It does. And then as people have told me, and it happened with me, if you meet someone here, then you deepen those roots quickly. So I met my husband and got married, and we're happy here.
I have a similar, well, not a similar story, but I came here in 1995, met someone, and married in 2004. So, yeah, I understand how that works.
They trap you.
That's true. Listen, Carrie, Lifespan, obviously one of the larger employers in the state, has a big responsibility to meeting needs of its patients, obviously, its consumers. So tell me, how does your role work? The Institute at Lifespan?
Sure. So the Community Health Institute is not the only by any means, but it is the primary demonstration of Lifespan's commitment to community, of community benefit. You know, all of our hospitals in Lifespan are not-for-profits. We all embrace a mission of delivering health with care, and we were all founded on principles of charity, as it was called in those days. And we still embrace our commitment to helping those regardless of their insurance status or income or where they live. So the Community Health Institute, the department that I lead, exists to help, our mission really is to achieve health equity, to achieve health equity. And that means we have to address health disparities by creating healthy environments and promoting healthy relationships and teaching and encouraging healthy behaviors. So that gives us a lot of breadth.
Sure.
There's a wide scope in how we can contribute to the goal of delivering health with care, but it means that we do a lot of skill building programs. We do some direct services addressing those health-related social needs.
Is that in or out of the hospital or both?
Both, actually. So, you know, originally when I got there 4 years ago, we were primarily externally focused, and appropriately so. I mean, our charge is to improve the health in communities. But increasingly, we realize, you mentioned Lifespan's one of the largest employers in the state. Well, we are now the largest employer in the state.
Okay.
And our employees are a slice of life in Rhode Island. And we both need to serve the communities in which our facilities operate, but we also need to serve our employees.
Sure.
And there's a lot of expertise in the community that can help inform and improve lines of service within our hospitals. So we really, in many ways, function like a broker. We're helping to build skills in community, but we're also trying to facilitate that exchange of expertise from the hospital out to communities and vice versa, from communities back into the hospitals.
So, Carrie, as one of, or the largest employer in Rhode Island, how does the organization focus on and ensure diversity and equity within the organization?
So Lifespan recognizes its both responsibility in the community to be a representative employer and a welcoming employer, but beyond responsibility, I mean, it is just our desire. We want to be the destination of choice, both for patients and for employees. And we know that a part of that is reflecting the diversity of the populations that we serve. So Lifespan has, frankly, for years, been quietly working on a lot of initiatives and partnering on a lot of initiatives like Year Up. We've been a Year Up partner for a number of years where we bring interns in. They're often young people. I say young because they're younger than me,
Sure.
but young professionals of color.
Yes.
That intern with us, many of whom we end up hiring. We have for more than a decade now been doing the summer youth employment program. Many people know we hire high school and early college age young people every summer. Scores of. Last year we were just about 100 young people.
Wow.
That get hired for the duration of the summer. They get job training, workforce development, and employed in different units across our system. Many of those people come back for more than 1 year in a row. We've had many who've gone on to be employed within Lifespan in professional roles or in other institutions in professional roles. It's a great pathway program. And there are many other investments in youth and workforce development, as well as career laddering programs. So we have been investing. We need to let people know what we're doing, because by inviting people to know, not just doing it quietly, but sharing the good news, we can learn and improve. But we also know we have to do more. I mean, it's just not enough. We know we have to do more. And so we actively kind of curate opportunities to do more investments. We want to continue to diversify our workforce. That's important at all levels of the workforce.
Yes.
At entry-level positions, at professional positions, at public-facing. You know, when you think about Lifespan, it's like a bunch of small cities. I mean, because we have, you know, plant and facilities, we have engineering, we have legal, we have accounting, and of course we have all the clinical and administrative roles. So it's like we have something for everyone.
Well, it's true, and most people don't think in terms of a medical center as being a little city in itself. And that is true. You have every department that the city has, but within the confines of Lifespan's physical operation.
Exactly, and we want to help create opportunities and help make people aware of the opportunities that we do have. And then we know, you know, we have to invest in our communities, because it's not just about when people are looking for the job, can they get a job at Lifespan, but how are we helping to prepare them to be successful in school and career. And so we do a lot of investments in youth programs, but also a lot of investments in community-facing programs.
Now, I know at one time Lifespan was investing some resources and time into what was then called a cultural competency activities and generating a way of looking at community, especially the community that surrounds Lifespan. Are you still doing that at Lifespan in some sort of way? We
do that in a number of different ways. So we do that in terms of thinking about how we're investing time, talent, and treasure to support both the geographic communities that we serve, especially those in the immediate vicinity of our facilities. But also that slice kind of runs through all of our work. I mean, across different lines of service, looking at, you know, how well are we serving patients of different ethnic backgrounds? How well are we providing access, regardless of the language spoken or where a person lives or their degree of mobility, disability status, all of that. So, you know, we look at it across a number of different dimensions. More and more, I think that's just becoming embedded in the way we do work. So it's not a call out, like there are a few people who focus on that and try to advise the rest of the system, but rather that it's infused, that there are standards and practices and expectations across the system, but that it's infused in all of our departments and all of our services. I think that's where we're moving. And really being more thoughtful about equity and inclusion and what that looks like for our business, for Lifespan as a business. And that's an ongoing conversation, but one that we've leaned into.
Now, medicine being what it is, I suspect that the majority of the employees in the hospital are female.
In fact, they are 3/4.
3/4.
3/4 are female.
Wow. And you know, it's kind of interesting. I used to work for the Department of Veterans Affairs, and of course our medical centers are in the hundreds in terms of number. And the majority of VA employees were female, even though we were servicing, at the time, the majority of the veterans were males. So it's kind of a flip on that whole issue. Being that that the majority of the employees at Lifespan are female, what is the growth potential within organization for non-female but minority employees?
Well, I think there's tremendous potential. I think there are things that we can and should and are doing. We're being a bit more cognizant of what our role is.
Yeah, you mentioned that program with the youngsters.
So, you know, from summer youth employment, year up, mentoring program, job shadowing opportunities. These are all things that we do, and we do them starting in elementary school. So, for instance, we bring the entire 5th grade class from Martin Luther King Elementary School in Providence over to the Miriam Hospital every year.
Oh, okay.
They don small-sized lab coats, they get a tour of the hospital, they try out different stations, they hear from different professionals, because the goal is, I tell them, we want to see you here down the road. Many of them have parents who work in the hospital.
Sure.
Or other family members.
That's interesting.
And we want them to know, like, you can be the president of this hospital one day, and here's what it will take to get there, and plant that seed. Then we reinforce that seed. We have programs that we do with middle school age students to give them exposure to health careers. Start thinking about the academic pathway that they should be on to be successful in a health career. We have a lot of programs at the high school and college level that we do with a number of partners. Juanita Sanchez Educational Complex in Providence, Rhode Island Nurses Institute Middle College, bringing students in a one-to-one mentoring relationship. Most of our executive team and a lot of our leaders across the system serve as mentors, where they make a 2-year commitment to work one-on-one with a student from a local high school.
Really?
To give them professional exposure, to help teach them and train them in professional practices, to reinforce the academic expectations, help them prepare for PSATs, SATs, review college essays, revising college applications. And then also just to be a friend, because we know the difference. I mean, this has been proven. There's ample research to show the difference that a caring adult can make in the life and life trajectory of a young person. So we've decided we shouldn't just talk about it, let's be about it. And so our leaders have stepped up. But we have these programs. We also have career pathway programs, free CNA training programs. We did a medical assistant program last year. We have the School of Medical Imaging that works with Rhode Island College and helps train students and then get them into jobs. We have excellent job placement and retention in the programs that we have to help prepare people. So we want to grow the capacity of those programs and make sure that people know and are aware of them to take advantage of those opportunities.
Now, is the School of Nursing, the charter school, is that Lifespan?
It's not a Lifespan owned. We're a partner with
Okay.
Rhode Island Nurses Institute Middle College. So we are a partner in helping to provide mentoring and shadowing and enrichment opportunities for those students.
Well, you know, it's hospitals, of course, are vast, and as you say, they're like little cities. I mean, you have engineering, bioengineering, electrical, of course. You have security issues, like any other place. Besides nursing, pharmacy, which is probably a big part of the budget of Lifespan.
Yes.
I'm guessing. So, do you interact with those different units?
So some more than others. The Community Health Institute, my department, is a department of Lifespan corporate. We work across all of our affiliates to help to design and deliver programs in the community, as well as that exchange, as we were saying, of expertise, bringing community expertise into the hospitals and creating opportunities for the affiliates to work directly with communities. We do a lot with, for instance, cancer. We do a lot with cardiovascular. We interact a lot with legal and with facilities, doing some of the planning and creating opportunities. Lifespan did a free a job training program for folks in the trades last year. So there's unlimited opportunities of ways that we can partner internally and externally.
Let me ask a question for our viewers. When we talk about Lifespan corporate versus the actual facilities? Is that what we talk, so if we talk about Miriam versus Rhode Island Hospital versus Women's and Infants?
So Women and Infants is not part of the lifespan system. We
Okay.
have Rhode Island Hospital and Hasbro
I
Children's
never knew
Hospital.
that. It's on the same campus.
We are neighbors, and we share a lot in a lot of ways, but we are actually different systems.
Okay.
So Rhode Island and Hasbro are lifespan. The Miriam Hospital, Bradley Children's Hospital, Newport Hospital, Gateway Community Mental Health, Lifespan School Solutions, those are all lifespan affiliates.
Okay.
And so there's, administration and
Sure.
offices and, physical plant sites, facilities for all of those affiliates. But then there are some functions that we centralize at the corporate level. HR and community affairs, so I'm part of community affairs, is centralized.
Okay.
And so that we can support all of the affiliates.
Gotcha.
Our offices for my department are physically located in Providence on Prairie Ave. We're community based and community placed, which is
Yes.
tremendous. It makes a difference.
I like that.
But we work across all the service areas of lifespan.
I know that I'm not going to hit you with a request for a specific number, but if you were to pull a number out of your head, what would you say the background, the demographics, the ethnic background would be at lifespan in general, if you could?
So overall, I wish I had the exact numbers
No,
for
it's
you,
okay.
Peter. Let me say this. There's a lot of diversity in our workforce, but that diversity is not represented at all levels of positions in our workforce.
Right.
So there's more diversity at the more entry-level positions, not unlike a lot of other institutions that we see, right? As you get to higher and higher in terms of rank and positions and more clinical and leadership roles, unfortunately, there is less and less diversity.
I find that interesting, though, Carrie, because a lot of the medical schools are graduating, maybe they're just not coming to Rhode Island, but a lot of medical schools are graduating ethnic minorities, people of color. They may be Indian, especially at one time it seems that every anesthesiologist in the country was from India. But, that, I don't know if that's still the case. Do we have youngsters, ethnic youngsters going to medical schools and looking for these positions?
So I don't want to speak for the medical schools,
Sure.
but I would say anecdotally, they also struggle. I mean, we are not where we should be in terms of recruiting minorities and persons of color to enter medical school. We are not graduating from medical schools diverse populations that reflect the U.S. population, nor the Rhode Island population. We struggle with residencies and placements to attract and retain people of color, not because they don't exist. No, they don't exist in the numbers that we want.
Right.
But they are there. So we need to do better at attracting them to our facilities within Rhode Island and keeping them here. As in general, we struggle in Rhode Island with lower reimbursement rates, especially compared to our neighbors. Someone could work in Connecticut or Massachusetts and make more money, just off the bat, make
Sure.
more money, because reimbursement rates are
And
higher.
that kind of trends in every industry, I think.
So, that's a struggle we have to overcome. Of course, we know there are many wonderful things about living and working in Rhode Island. And again, we want Lifespan. Lifespan wants to be the employer of choice. And to do that, some of the things that we're doing is really focusing on creating a culture of well-being. Because we know that salary matters, but salary matters up to a point. Then there are other considerations
Sure.
that have to factor in. We want to reduce burnout. We want to create an environment where people are satisfied and where they see opportunities to grow and be rewarded emotionally and physically. That's about physical health and well-being. That's about family supports. That's about helping families and employees with financial planning, not just their own retirement accounts, but also college planning. So we've introduced services like that so that folks know that this is an employer that cares about their family well-being. So we have college planning services that we bring in to help our employees. We've created opportunities for civic engagement. We now have Team Lifespan. So Monica Anderson, who's our Director of Community Relations and Corporate Citizenship, has worked with our Working Healthy group to create opportunities for Lifespan employees to come together to engage in physical activity, walking, running, bicycling together, but also to engage in service opportunities together. So we have Team Lifespan doing volunteerism in the community because that matters to people. You want to be somewhere where it's not just talking about the values. Lifespan's values are care, compassion, accountability, respect, and excellence. We've really embraced them, and we know it's not just about using the words, but creating opportunities and holding employees accountable to demonstrate those values in our day-to-day work.
I was going to ask you that. Those core values, and how are those values made part of, let's say, new employee training?
So it's funny, we had students in here for an orientation program a couple of weeks ago, or at Lifespan for a program, and one of the Lifespan employees asked, can anyone tell me what the core values are for Lifespan? Every student raised their hand.
Okay.
It is embedded in our new employee orientation, in our student programs. We've even embedded it into our employee performance reviews.
Very
So
good.
I don't just want to know, did a person show up to work every day and how well did they perform their job, but how did they demonstrate compassion in their work? How did they demonstrate accountability? We're now held to that standard, and it's promoted across our system. We're actually finishing up a call right now to ask employees to nominate a care value, someone who's demonstrated the care values well, to identify a care champion for the year. In a week's time, we had more than 90 nominations come in of people just doing ordinary things, sometimes extraordinarily,
Yes.
are going above and beyond, because compassion, accountability, respect, and excellence is just something, I think it's something that in a caring profession like healthcare we lean toward, but we have been overwhelmed with examples of how people demonstrate the care values, whether someone's looking or not.
You know, it's interesting. Healthcare obviously being very, very important to the typical American. And when we think sometimes of the police department as an organization that it's a necessary evil, there are many people who think about healthcare in the same way, mainly because of historic issues with costs. If you didn't have insurance, you can't go there. That kind of thing. Now, I understand about the humanitarian part that hospitals do play and that Lifespan plays. But how do we get past that whole issue, number one, of I don't want to go to a doctor because I don't want to know. I don't want to go to the hospital because I can't afford it. But yet, healthcare is probably the third or fourth most important thing in your life, if not the important
and
thing.
until there's some traumatic event, then it becomes number one, right?
Right,
Because
exactly.
you have to overcome that health issue. You know, we really want to move toward being a place of wellness and a place of well-being. I mean, that's healthcare in general, right? We're moving toward, you hear these terms like accountable care and holistic care, and that's where the industry is moving, and that's a good thing. We don't want to just see someone because they're hurt. We want to help keep them well, teach them how to live healthy lives in healthy communities, help to create, because it's not all one person's ability nor responsibility to manage all the factors that influence health. We want to help to create those healthy conditions for people to live and you know, work and play and pray in.
Yes.
But we have created creative ways for our healthcare providers to be more holistic in how they engage with a patient. So, as an example, we have a program called Connect for Health. Again, this is one of these, you know, little known, but been operating for more than 20 years. A program at Hasbro Children's Hospital that this year also expanded to the primary care clinic for Rhode Island Hospital, where families come in and the physician, when they're interviewing the patient, may identify that there's a barrier, a housing issue, a food insecurity issue. The parent may need help with childcare. Maybe a new baby's coming into the home and they don't have a crib. The Connect for Health program is there to help families navigate to the community supports that they need. Help them fill out applications so that they can apply for WIC and SNAP. Help them identify where they can go to get clothing or furniture. And not just say, here's a referral, good luck with that,
Right.
but literally follow up with that patient, help them complete an application, check in a few days later. How did that work out for you? Do you need any more help? So we have Connect for Health serving more than 1,000 households a year, just with 2 desks and 2 clinics.
Wow.
More than 1,000 households a year, helping them address some of the basic needs that get in the way of health and well-being.
And that's interesting to know, because I'm sure most people don't realize that a hospital will do that. You know, we think about getting into the emergency room and we think about getting out. It's all the stuff that happens
All that
in
other
between.
stuff that matters to deliver health with care.
Exactly, exactly. Well, I'll tell you, I've learned a lot today. But one of the things I also want to know about, going forward, how do you see Lifespan in terms of its growth? not only physical within the confines of the city of Providence, but generally speaking, its growth with its patients and its community.
Well, you know, it's interesting. This year we've seen record numbers of ED visits. I know, you know, viewers may have experienced or heard from their friends and neighbors some of the challenges. We did so much work to bring down ED wait times. I mean, we drastically cut emergency department wait times, and unfortunately, they've crept back up again.
Is that because
Since
of
the
the
closure
opioid?
of, well, it's partly opioid and some of the needs that are coming in. It's partly the closure of Memorial Hospital, and particularly
Sure.
with ED visits at Miriam, that's driven up volume. But so we want to get our hands around that, because we want to deliver the best care possible to patients, and we want to do it with the most efficiency possible, right? So we're looking at how to best deploy and be flexible and nimble with our services in emergency situations, but also in those regularly scheduled preventive or specialty visits. So we are always working on improving quality, and we're pleased that, you know, in the last few months we've gotten a number of accolades from national, you know, rating groups and systems that show that we are providing some of the best care in the state and in the region. We want to stay there, but we also want to think about how to grow our community footprint. And unfortunately, when you look at public health data statewide, we're not reducing disparities at the pace that we want. Making some gains, actually experiencing some setbacks. You know, diabetes is a major issue.
Absolutely.
And pre-diabetes. We see disparities in screening rates and treatment outcomes, you know, by
Sure.
disease area. So we want to continue to focus in on some of those disparities, identify strategies. Sometimes it means us leading, sometimes it means us partnering, and we partner a lot with other community groups that share expertise and share access to populations to really continue on the path to improving population health.
Well, it's healthcare is probably, like I said, it's probably the #1 thing in most people's lives. If you don't have your health, it's kind of hard to do anything else. And as Americans, we weren't really taught to do pre-maintenance. We always reacted to it after the fact. Carrie, listen, I appreciate you being on the show today. We'll have to have you back because I have some other questions I want to ask.
I'd love that.
I'm sure the community would like to hear from you, and we appreciate the fact that you're here and doing what you do. But actually, we've run out of time.
Well, thank you for having me, Peter. It's been a pleasure, and I really appreciate what you do in helping to bring information to our communities, so thank you.
Well, thank you. And because we've run out of time, but I want to thank today's guest, Carrie Bridges-Feliz, and you, the viewers, for tuning in to another segment of In Another Opinion. A special thanks to PBS for making this program possible. I'm your host, Peter Wells. Follow us on Facebook and Twitter at IA Opinion, and have a great day.
The Rhode Island Foundation, partnering with passionate Rhode Islanders to lead, transform, and inspire our state. Learn more at rhodeislandfoundation.org.